Cardiac surgery associated acute kidney injury is a problem. First, because it is frequent, occurring in 30% or so of all patients who undergo cardiac surgery. Second, it's associated with hospital costs, increased ICU stay, increased length of hospitalization, extra medications, severe AKI, dialysis in the hospital. And finally, it can lead to long-term consequences on kidney function. Chronic kidney disease, progressing even to end-stage kidney disease and the need for dialysis and/or transplant. From a nephrologist perspective, these are patients who are quite hemodynamically unstable. They often require management of fluid volumes that require close monitoring of the patient. In the most severe cases, they even require dialysis, which in a patient that has just undergone open heart surgery is a very complicated process. It needs anticoagulation, and these patients are prone to bleed anyway. It needs lots of monitoring of fluid volumes, hemodynamic status. So these are difficult patients to dialyze because of that hemodynamic instability. The underlying causes for a kidney injury following cardiac surgery are multiple. They include, first of all, the hemodynamic perturbations that occur during surgery. Decreases in blood pressure, decreases in cardiac output, all affecting perfusion to the kidney. Those patients who need transfusions frequently have free radicals from the transfusion, free iron species that are toxic to the kidney and can be injurious to renal tubular cells. So those are the main causes. Most of it we would describe as ischemic in nature. The role that cardiopulmonary bypass per se plays is probably a very significant role. It is, first of all, the cause of the changes in perfusion to the kidney. So how the perfusionist regulates flow determines what flow is getting to the kidney. But I should say that although cardiopulmonary bypass is important, we know that acute kidney injury occurs in off-pump patients who undergo cardiac surgery. So it's not limited to on-pump patients. Clinical impact for patients and their families includes prolongation of their hospital stay, which is always associated with increased risk of infection, other hemodynamic challenges. Second is the long-term implications. So you're losing some nephrons when you develop kidney injury. Many of these patients, because they're older, because they have diabetes, because they have underlying heart disease that gets them into the operating suite, already have depressed kidney function. A further injury on top of that can further compromise their kidney function to the point where it starts to produce significant symptoms for the patient and may even, as I said earlier, lead to end-stage kidney disease and the need for dialysis. Well, the recent Medicare designation that hospital-acquired kidney injury is something that the hospital is going to bear the financial costs of, I hope means that greater attention is going to be paid by practitioners to preventing hospital-acquired acute kidney injury.